And it's not so much the money we're spending in the jury room, it's the defensive practices that doctors have to practice in fear of being. That's not me saying it, that's Price Waterhouse analyzing the $2.4 billion we spend in health care. So you cannot have a bill that does not have malpractice reform in it, first and foremost. I will tell you I have a problem with insurance companies. The reason we have insurance is to protect ourselves in a time of need. An insurance company should manage risk, not eliminate it. And too many times now, you get in a car accident, they take you away. They're not going to make profit on everybody, and they shouldn't. They should manage the risk and expand the pool. We should take care of those who are uninsured, but those that are truly. In your packet, you will read that the number goes somewhere between 46 and 48 million people are uninsured. Now let me walk you through that very quickly, because we can handle this without taking away everybody else's health care. The largest group that is uninsured happens to be between the ages of 18 and 34. Why is that? Because those are your healthy years. You think you're invincible. I support an amendment that would put into the bill that would keep you up to age 25 on your parents' health care. These are healthy people. Keep the pool there. I would tell you, if you look further on the uninsured, there's 11 million people who already qualify for Medicaid or S-CHIP. If we go put another government program, why do we think they'll join that one? There's an easy way to do this with common sense. Judy and I's daughter happens to be Megan. She just went into the 7th grade. They wouldn't let her enroll in school until she went and got her shot. Well, why do we let somebody enroll in school that, from a standpoint, is eligible from health care? You can analyze that based upon the school lunch program, that maybe they belong there. Take the wellness of them, make them weller in the process of going forward. There is a number of millions of people, 9 million that make more than $75,000. There's about 17 million people that make more than $50,000. I will tell you, I'm not going to take tax dollars, pay for somebody's health care that mismanages their money and buys a boat instead of the priority of their health care. Pre-existing conditions. We can write a bill that says you're going to offer health care. Now I want to ask you one question. In this room, how many people call up and have Geico for their car insurance? Do, right? All right. So these people are willing to pick up the phone because some lizard or gecko tells them they have better insurance, right? Nothing against it. I like it, right? Or, you know that other insurance company, Progressive. You ever see those ads where somebody walks in and says, well, I want some of this, I want some of that, but I don't want this. And then they say, well, just tell me how much you want to spend and we'll build a plan for you. But when you call that company, you know what? You're calling across state lines. We don't allow that in health care. You can only call within the state, can ask for a plan. And what happens with that? You get two big companies that will control it. Let's open this up, bring the free market into health care, and lower the price. I believe these are common sense ideas 80% of the Congress can get to. Now, to run the bills, to run it through, this is another problem I have with this. This bill was introduced in July, 17 days before it's all the way through committee. It's 1/6 of the entire economy. It can affect each and every one of us. That is not the way to run Congress.